Hi, Dr. Goodwin. Derek Todd here.
Yes, Derek. Good morning. How are you?
Very good, thank you.
Good. I say Derek from one doctor to the other. Um, Today, I'm now speaking to the Health Power audience. Today, Dr. Derek Todd and I will be discussing juvenile or childhood arthritis, which affects about 70 to 100,000 children in the United States. Dr. Todd is a rheumatologist or joint specialist. He is director of Brigham and Women's Rheumatology Musculoskeletal Ultrasound Center. Those are very big words, Dr. Todd.
Yeah, that's right. I have a hard time getting it on my business card.
I imagine so. He is also an instructor of medicine at Harvard Medical School. Both Brigham and Women's and Harvard are in Boston, so I'm sure quite a few people in our audience have heard of the famous Harvard University and Harvard Medical School. Dr. Todd,
Mm-hmm.
tell us what juvenile arthritis is, and then I understand that there are two major types. There are either two types or more than two types, but give us a little bit of basic education on what one means when one says juvenile arthritis. The reason I ask that way is because I understand there's something called juvenile idiopathic arthritis. I think idiopathic means unknown cause. And then there's another kind which is called JIA, systemic juvenile idiopathic arthritis, which I think is more widespread throughout the body. But you're the expert,
Yeah.
so why don't you explain those two types to us?
Sure. Well, thank you for the question, and I apologize for the alphabet soup of the terminology sometimes. It can be quite scary for parents who are trying to navigate this. Juvenile idiopathic arthritis is the most common chronic arthritis that affects kids.
Can we call that juvenile arthritis? Is that?
Yeah, idiopathic is one of those terms that is rather an unfortunate bit of medical jargon. And so we don't often think of arthritis affecting kids, but it does. And when it does, it can be quite severe and scary for parents and for patients.
Yes.
There's a number of different types of juvenile arthritis. And the most severe type is that systemic type that you mentioned, where the body's immune system there's inflammation, and the immune system is attacking not only the joints, but is also attacking other parts of the body, causing fevers and rashes, and can even lead to organ failure, and rarely can be fatal, which is quite frightening, of course. Kids are often hospitalized, and there are concerns about infection or leukemia, and then those things get ruled out, and then the rheumatologist makes the diagnosis of juvenile arthritis or systemic juvenile arthritis.
Let me ask you a question. Is systemic juvenile arthritis similar to a bad episode or bad condition with rheumatoid arthritis in children?
Well, that's a great question. So systemic juvenile arthritis is really a subset of this broader term, juvenile arthritis. And in fact, there's a different type called polyarticular, or PJIA, that affects many different joints in kids, is still quite serious, and is probably the type that most closely resembles adult rheumatoid arthritis, which the audience may be more familiar with.
Okay, so why do children develop juvenile arthritis? I realize there are multiple types, and we're talking about, if I were to try to summarize for the audience, and you can tell me if I'm correct, one type mainly affects joints, and its cause is unknown, and that's the idiopathic juvenile arthritis. And the other type is much more severe and affects multiple joints throughout the body as well as some organs in the body, and that's the polyarticular. But what causes it? What
Well,
causes either type?
those are great questions that remain unknown, unfortunately. The term idiopathic describes that unknown nature of this. However, there is a common thread of inflammation, that the body's immune system is overactive and attacking the joints or other structures. And so we apply the term autoimmune disease to those conditions.
So it is an autoimmune disease.
That is correct.
When the body sort of is attacking itself, or something in the body is attacking itself because of an immune deficiency, and we don't really know why it's happening.
Well, these are conditions in which the immune system, which should normally protect us from infection, goes awry and starts attacking normal body tissues. And we don't understand what causes them.
I see. Is it more common in the adult members of the family?
Another good question that we get asked quite frequently. There is a genetic component to juvenile arthritis, but most kids who have this condition do not have a family history of it. So it is something that parents need to be alert for in other ways, looking for kids who've had setbacks in their physical function. Think of a 4-year-old who's normally running around and vibrant, who then has a setback and starts limping or even crawling around just trying to get around the house without any injury or other explanation.
So it's not necessarily at birth. When after birth does a child most likely develop juvenile arthritis?
You're correct that these are not usually conditions of real infancy. It's something that usually is not picked up until patients often start walking. And age 2, 3, 4, that's about the time where this could start. But again, it's quite rare. And there's another peak in adolescence of the polyarticular type, which more resembles adult rheumatoid arthritis. So it depends a bit on the different subtype of juvenile arthritis as to when it's most likely to strike.
What treatment is available for it?
Fortunately, there are many treatments available, and this has really evolved nicely over the last decade or so. Historically, steroids and bracing and wheelchairs were really the mainstay, and that's unfortunate because kids did terribly. And nowadays, we try to be as optimistic as possible with our patients and their families to explain that we can treat their inflammation, we can treat their pain, we can get them back on the athletic field or in the orchestra, and they can do whatever they want to do with the proper diagnosis and treatment.
Now, one thing I just want to clarify. You said steroids, and after steroids, did you say racing?
I'm sorry, bracing, like wearing braces
actually
and stuff.
Putting braces on.
Yeah, sometimes. Historically, now, fortunately, much of that is treatment of the past. Those sorts of approaches are for patients who've had significant damage from their disease that many of the medicines can prevent.
And now?
And now we can use a number of different medical approaches. There are prescription treatments, all of these, so it's important to discuss with the treating doctor what's right for the patient. There are a number of new biologic drugs over the last 5 to 10 years that have really changed the face of this condition so that we can select the correct treatment for a child, ideally, so that they do very, very well.
All right. Now, as a parent, what are the main signs and symptoms? Are they going to be the child having difficulty moving around with motility, or are going to be sore and joints that are red and hot and swollen? What do you look for? You got it.
It's all those things. So it depends a bit on the age of the kid. An adolescent is able to describe joint pains and swelling, and their athletics may suffer or other activities that they do. As a child, though, a 3 or 4-year-old may not be able to express the concept of pain, and therefore it might be observed more that they're behaving differently, that they're limping, or that they're regressing functionally.
Okay. And where can viewers go to get more information about juvenile arthritis? As a lay person, of course I'm not, but if we were talking to our lay audience, which is not all lay, it's also health professionals, but what's the non-alphabet soup, to use your term?
Yeah.
Can we just say juvenile arthritis?
I love it. That's great. because we want to try to take the confusion out of this diagnosis. It's already confusing for parents to have a child who's suffering with pain and functional limitations. I'd recommend first talking to the patient, to the kid's doctor, to the pediatrician or the family doctor.
Primary care physician.
Primary care doctor first, and then that doctor may refer a patient to a specialist, be it a rheumatologist or a pediatric rheumatologist who specialize in treatment of these conditions.
Right.
Online, there's a couple good websites that I can recommend, including the Arthritis Foundation has...
Let's go slowly on the online
You got it.
resources.
Okay, kidsgetarthritis2.org.
That's kids, K-I-D-S,
Yep.
get, G-E-T, arthritis, A-R-T-H-R-I-T-I-S-T-O-O?
Yes, that's correct. .org.
.org. And is that the American Rheumatology?
That is the Arthritis Foundation.
Arthritis Foundation.
And then the American College of Rheumatology has one, rheumatology.org, which...
Just one second. American College of Rheumatology. And theirs is called what?
Rheumatology.org.
Rheumatology.org.
And both of those are informative, and it's important to avoid misinformation, which is unfortunately rampant on the internet with regards to these rare conditions.
That's why I wanted to be sure we could tell our audience where they could go to get more information that you and I both know is very reliable.
Yes.
So let's just repeat that. kidsgetarthritis2.org.
Yes.
Which is from the Arthritis Foundation.
Yes.
And the American College of Rheumatology, which is rheumatology.org.
Excellent. Yes.
Okay, well, it's really been a pleasure talking to you about this today, and it's informative, and now you and I know that more people know about juvenile arthritis and how to handle it.
Well, I appreciate this forum. Thank you very much.
All right, so long.